It's an honor for French Ministry of Health to be invited at such an introductory conference. I'm sorry for my English, but I hope it's going to be okay. We're, of course, very honored that this conference is being held here in Paris and here in APHP, and in this place full of history, as recalled Professor de Moor. And I must say I'm quite impressed by the audience who's gathered here, the international ship of the audience, and as well the level of it. Okay, so as Professor de Moor said, I would say a few words about data and big data especially. From the point of view of the French Ministry of Health, we are facing quite a paradox. You know the famous sentence about where the computers are everywhere except in productivity statistics. We could say quite the same about data. Everybody is talking about big data, smart data, and for yet we don't really know what the uses are going to really be, and we didn't have seen much of results. We know it's everywhere. We know many projects are in course, but for the moment it didn't produce much. So your project is really important from this point of view. It's kind of proof of concept, we could say, for big or smart data. What I can observe right now is that it took quite a long time. Professor Kappa told me it had already taken 5 years to get to this point. So we can see that interconnecting all those data is really a big matter, and it needs time and it needs much efforts. And I understand you're very happy and excited to see these efforts come to this point today. And I can say we are as well, because this project is going to be one of the first to produce data and results. What I can say as an introduction as well is that something very important from us is we see the strategic importance of healthcare data for clinical research, and this is one model. Many others were possible to gather data and use them, but the fact that we have been introduced with many projects which use clinical data to identify patients and then develop clinical research projects from these data. We see that there is a kind of convergence around this model, and I must say it wasn't written, and it isn't a surprise. It was one possibility, but there were many others, and it's the one that seemed the most promisable. Okay, so from the ministry's point of view, what's at stake with those kinds of projects, which are full of promises, but also of questions at this point? And I'm speaking from, as said Professor de Moor, a point of view of my direction, with the General Direction for Healthcare Organization. And we have been involved for a long time in clinical research. We have been promoting and operating the French program for clinical research, which celebrated 30 years a few years ago. So we know this field, and we have a long experience of what clinical research should and could produce, and how it can be used for the French the public regulation of the healthcare organization. So I listed six points and six takes. The first one is, of course, healthcare quality, and the fact that those kind of projects will be able to accelerate discoveries and to accelerate patients' access to new drugs and new products and new healthcare organizations, which is for us, of course, the first point. The second point, as you demonstrated, is the research quality and efficiency, of course, and you demonstrated, and what's gonna follow in the day will show it more accurately, I think. That what you've been setting is really able to accelerate and to increase the quality of the research. From you insisted on it, and from our point of view, it's also a really important thing. Many projects have been deeply in the field of technical interoperability, but this can be only the underlayer. The real point is the semantic interoperability, of course, and I understand you've been working on this for many years, and this is really the heart and the strategic key point of the project, and we share this point of view that many projects couldn't achieve their goals because this point wasn't faced with enough energy and enough early enough in the project. Our third point is innovation. Innovation of products, of course, of drugs, of organization, but also of study designs. And we understand that those new kinds of that your project is one of its main goal is to try new study designs and to make them reach high level of proof, which is for us very important. Innovation is design studies. It's also the nature of products and of organization, and for us it's very important that the studies you're gonna lead with this project could prove the effectiveness or non-effectiveness of new healthcare organization. For us, it's been kind of, as we say in French, parent pauvre of the healthcare research, and we are really betting on this for the future, and perhaps more than on drugs. The fourth point is that research has to produce good data and good assessments, because for us data are really at the heart of our jobs and what we're aiming to, because we have to know what we are authorizing, and for this we need to have very good data which didn't miss anything on patient safety, which is of course the first preoccupation of French Ministry of Health. And second point, what we are paying for, and this is also of course something very important in the future, and for this data are really at the heart of the matter. In two ways, I could say. We have to be sure that the data produced are of sufficient quality to be sure what we're paying for, but also we didn't miss anything, and that we are not in kind of broad zone where we couldn't decide anything and take bad decisions in one sense or in another. So this question of data quality, and of course of the thoroughness of the studies, and then of the size of the patients, you could gather, is at the heart of the question. The fifth point is of course what's around the patients, because it could have gone first, but I know you know everything about it. But the first point is patient security, but also privacy. And it's in French we are really well focused on this point. Maybe you've heard about the law for modernization of healthcare system, which was just voted on January this year, and one of the key points of this law is the overture of what we call the SNIRAM, which is a typical French name for the data system of the French healthcare, social security. So this is very important because it's one really big database, because we have every French patient in it with 10 years deep, so an enormous amount of data. But the key question was, if we gave an access to these data, who can access, for what, and which with privacy guarantees. And it was really one focus point for the parliaments, and most of the discussions went around this question. So for us, data security and the privacy has to be at the highest possible level. And I know for this we have different approaches in Europe, and but there's a especially strong focus on this in France. Okay, and the sixth point, and we have also a special history from this point of view with the mediator story and others. It's the question of interesting links and transparency, and we are very conscious that this kind of project, which deeply associates universities and industry, it has to be this association, and very deep association, is really useful and necessary to conduct good studies, which allow as well industrial research and good data production. But we have to be very careful about this transparency and these interest links. And I think for you, this can be maybe something you have to assess really deeply. And okay, so these were the 6 points, very briefly said. Once again, I'm very honored, and we're glad that this conference can be held today, and that you can have this full day of work. And I wish you a good day, and I can assure you that we are going to watch what's next with great interest.